The broadcast is now starting. All attendees are in listen-only mode.
Okay, thank you for joining part 2 of our M22 series of webinars. Hopefully some of you were on last week where we discussed the IPL part of the M22. Today we're going to concentrate on Surfax and touch a little bit on photofractional treatments as well, which is a combination of both. For this slide last week, you see that the energy-based device, if you look at the energy-based device category, skin treatments is one of the fastest growing segments. If you look at the dark blue section on the bottom, we can see that year on year growth, we're looking at around about 50% growth. And this is set to continue. So we know that this is a really high growth category where people are looking for treatments. If you look at the broader category, we see that IPL and laser skin resurfacing are amongst the top 5 minimum invasive procedures and are growing every year. And we know there's a non-ablative trend that people are tending to want and demand non-ablative procedures because people really don't want the downtime anymore. People are looking for these lunchtime treatments. During the 2015 survey by the American Society of Dermatological Surgery, consumer survey, 50% of people in that survey said they were considering some sort of energy-based cosmetic procedure. But that 50%, 66% were looking for skin tightening or wrinkle removal. We looked at last week the reduction of redness and the tone of the skin, and we saw how the IPL can help for that. So what we're going to look at today is Resurfax and how we can help these 66% of people who are looking for this treatment. The M22 combination system, you can see in the bottom right hand corner, we combine 4 devices. It combines the ND YAG, it combines a Q-switched YAG, it combines a high powered IPL that we talked about last week, and it combines about the Resurfax that we're going to look at today. There are 2 options for skin resurfacing. I've seen both, I'm aware of both, and I know the machines for both. There's an ablative where we use a CO2 laser. Luminous have 2 great machines, 2 leading machines for this procedure. The Ultrapulse, which is deemed to be the #1 CO2 laser in the world. And the second best machine in the world is another Luminous product called the AccuPulse. And ablative treatments were the only solution many years ago in my first involvement with CO2 lasers in the aesthetic industry. Was for the ablation of full face ablation, where the downtime would be many weeks. Things have improved because now you can get fractionated ablative, but still with the fractionated ablative CO2, you have to remove thin layers, you have to remove layers of the skin. It's more aggressive because it goes deeper, you get a longer downtime. There's a bigger risk for potential side effects, there's a lot more counselling on the patient after treatment, and there's a lot more involved. But the upside is you generally only need a single session. You can see well-documented results on Luminous website, and I know many practitioners using CO2 that get unbelievable results. The problem is that 9 out of 10 patients these days are looking for a non-ablative procedure. So non-ablative, it allows you to be able to stimulate collagen without damaging the epidermis. So there's no removal of skin layers. They're less aggressive because they're more superficial. You get a very fast recovery time. The lunchtime treatments, there's a less risk of side effects, is indeed very low risk of side effects, but you do require multiple sessions. You are looking at about 3 to 5. I generally say to my clients it'll be a 5 procedure and looking at doing a top-up procedure every sort of 12 months. So the IPL we looked at last week, we looked at the universal IPL I talked to you about last week, and it's still my ultimate choice for looking at altering the skin colour. So when I want to rejuvenate from the outside in, the IPL is the best choice. It's a great machine for reducing vascularities and pigmentation. And I talked to you last week about how the IPL with the vascular filter was my choice of machine for treating vascular lesions and for veins on the face. I no longer need to use my pulse dye laser because I get much better results with it. So today we're going to look at the second part of the technology, which is Resurfax. It really is, it's a true fractionated, non-ablative skin resurfacing system. It's got some fantastic, it's called the Cool Scan technology. It's a mirrored system, delivery system, and we're going to look at the scanning technology today. Next week, we're going to look at the We're going to look at some of the other aspects of the machine. The talk is based on the Q-switch, but we are going to touch on the multi-spot ND-AG during the same webinar. Q-switch one, it's a system, gives great results on dark colour tattoo, but it's also one of the most popular treatments at the moment for carbon peels. I'll show you a video at the end. So with all luminous modules, the Resurfx is easy to use, it's got amazing presets, and there are no disposable or consumable costs. So the M22 module, you can see that if you look at the centre of the machine, the centre module here is where the Resurfx sits. So it's actually a module that you can upgrade to the system. Indeed, you can buy a version of Resurfx on its own. You can speak to your local rep, and you can buy a Resurfx module that's built into the packaging of the light shear, which is a standalone system. The system I use is part of the M22 because I like the other aspects of M22. So Resurfx is a fractured non-ablative system. It's a 1565 nanometer fiber laser, and it's easy to use. So you can see the screen, the application screen there. You can press dyschromia, acne scars, surgical scars, skin treatment, stretch mark. Like I showed you the screen last week, you can then type on the skin type, severity of the condition you're looking to treat, and the machine will come up with recommended parameters that you should choose to use. And these are great starting points when you're first learning to use the machine. The indications for use are collagen stimulation, non-ablative skin resurfacing, dyschromia, scars, stretch marks, wrinkles. Its technology is a fibre, so it's a fibre laser, 1565 nanometer. That means that the cavity consists of a coiled up fibre with mirrors at either end. It's a cool way to be able to produce high energy from a system. It's got continuous contact cooling, and it's a true fractionated. A lot of fractionated systems get depth of penetration. You have to do 2, 3, 4, maybe 5 passes. This only needs a single pass. The high energy allows you to just do a single pass to be able to get depth of penetration, because you can adjust the energy accordingly. It's got a non-sequential scanner that allows us to offer safer treatment. It doesn't dump and deposit all this energy in a single pulse. So a lot of machines would deliver 300 spots in one complete scan, in one complete instance. This scans the area, so it allows you to have relaxation time in between the pulses, allowing the skin to remain cool. It's a much better way to deliver. There's 600 different parameters that you can choose. Why 1565? You can see from the curve, you can see the absorption in water. 1565 has got a high absorption. The absorption in water is higher than there's a high absorption in water, very low absorption in blood, and a very low absorption in melanin. So it's preferentially target chromophore is water. That allows us to get great stimulation within the water and to stimulate collagen production. But because it's below 2000 nanometers, it's considered non-ablative. You can see that 2000 nanometers, the absorption in water is so high at 2000 nanometers that you can see the absorption here is so high at 2000 nanometers that they become ablative. So any wavelength over 2000 nanometers is an ablative wavelength. So if it's ablative, it has to cut through the epidermis before it can stimulate collagen. The big advantage of non-ablative, you pass the energy through the epidermis without damaging it. So it will tend to create coagulation zones of heat rather than cutting tissue. It's a much better way to be able to stimulate collagen with a much lower risk of side effects. So the principle of operation, you need to match the thermal relaxation time. We're not going to talk about thermal relaxation time again today. It's a whole lecture on its own. You're welcome to attend one of my lectures on that, where we discuss parameters more in depth. But the important thing is that the wavelength is below 2000. If you use an erbium YAG at 2940 or 10600, then these become ablative. So you get you end up damaging the epidermis before stimulating collagen, which means you've got a long recovery time. A fractionated system is you need to deliver these microbeams. So the idea is you break the beam up into smaller spot sizes. You can deliver with the Resurfx from 50 to 500 microbeams per centimeter squared. The energy passes through the epidermis, and then you get these zones of coagulation of heat. So you end up with these coagulated zones. That creates a thermal injury in the dermis. The body sees that as an injury. The body then responds by upregulating fibroblast activity, which stimulates new collagen production. A natural healing response, and then you get new healthy tissue formed. The idea behind it is to create this effect so that we can plump up wrinkles and rejuvenate the tissue. Because this aniconia is maintained, you haven't got the risk of infection. So there's very low risk of side effects. You can coagulate zones up to a depth of 1,000 microns, sparing the tissue in the surrounding columns. The important parameters, so unlike when we talked about last week, we talked about that the wavelength was critical to the depth of penetration. So when you're using an IPL, depending on the setting, will depend on the depth. Because of the absorption in water, the depth of penetration depends on the energy. So what we're able to do, we're able to select a low 20 millijoules to go very superficial, or I can go as high as 70 millijoules if I want to go deep. That allows me then to be able to target the area I want to treat. So for instance, if I want to remove a wrinkle, I have to go deep. So I would maybe choose a small line, deliver the energy at 70 millijoules, but then when I want to rejuvenate the tissue, I may go for somewhere in between. Whereas if I want to remove pigmentation, I would use a low energy setting at 20 millijoules and more microbeams to target the pigmentation. And we can look at that a little bit more in depth. Second most important parameter is the number of spots. So most systems have a fixed scanned, so they can maybe only deliver 200 or 300 spots. It's good to have variation. What I like about the Resurfex is I can vary from 50 microspots per centimeter squared up to 500. So if I want to use high energy, I'd use a low number of spots. But if I want to say remove pigmentation, I need a low energy with more spots. And it's good to be able to alter the size. So with some machines have a fixed spot size or fixed scan size, because this is a motorized mirror system, you're able to change the shape, and we can go from 5mm to 15mm. So if I want to remove wrinkles and scars, treat wrinkles and scars, I need a low number of spots but really high energy. But if I want to remove pigmentation, I want a high number of spots with low energy. The second thing is how we deliver it. You've got traditional systems of a fixed scan. You can see a fixed scanning system on the left. So a fixed scanning system would deliver all the energy in one impact. On the Resurfex, it's a scan technology. The scan technology, I'll show you a video of it scanning in a little while. Scan technology allows you to limit the thermal impacts. If I'm delivering 300 spots in one go, that's a big thermal impact on the tissue. Whereas if I'm delivering it in a scan technology, you'll see that it'll only put the pulses down one by one. So it never puts a pulse next to each other, which means that you limit the amount of thermal impact on the tissue. And that helps us with recovery time. The other problem with the stamping technique is you can end up with a linear pattern. You can end up with hot spots. Often referred to as tiger striping. The advantage of non-sequential scanning is relaxation in between. Also, if you've got a built-in cooling system in with it, like the Resurfex, it allows them with the recovery time. And I've seen a dramatic improvement. The older systems I've used can be 5 to 7 days before recovery, and this is a non-ablative system. And you'll see when I talk about recovery times, generally when I treat with the Resurfex system, because I can limit the damage, the high energy impact to the wrinkle itself by using a line, and in a general resurfacing, generally the next day the clients have complete recovery. So it's because of this limiting this impact on the epidermis by using a non-sequential scanner. You can see the video running in the non-sequential scanner. You can see this is slowed down because it goes much quicker than this. You can see that it scans the area, putting the pulses down one by one. So it never puts the pulses next to each other, and it spins around until it finalizes the whole area. Say this is slowed down and it goes much quicker than this, but it allows you to limit the thermal damage. And I believe this is unique to the Luminous system. It's innovative engineering from Luminous. It allows you to change the shape, change the density, but the important thing is to limit the thermal damage to tissue. That helps us with recovery time. See this video hasn't quite worked, but this is on a thermal paper. You can see slide 1, slide 2, it starts to scan, slide 3, it fills it in, and 4, you can see the complete area. Resurfix has 6 different shapes you can choose. You can choose a line. So if I want to do a wrinkle, I would go into a line. It has a rectangle. Rectangles are really good, and you can use rectangles when you treat stretch marks. I want to do high energy, and I would limit the thermal impact of the stretch mark itself. And I would use a rectangle. You can use squares. You can use circles. Circles are quite useful. I use a small circle if I want to go into an acne scar or any sort of scarring. I want to fill in at high energy, I would use a circle. And the great thing about acne scarring then, after the second pass, you can use a donut mode. The donut mode allows you to go somewhere in between the spots and energy to feather it in. And then I tend to use hexagons quite a lot, because hexagons fit together really well. And that allows me then to resurface over the top to finish the procedure off. You can go from a 5mm up to an 18mm, depending on the shape that you're selecting. And you can go from 50 microbeams all the way up to 500 microbeams. So as I said earlier, lower end for deep work at high energy. And when you want to do more superficial work, particularly pigmentation, you use low energy with a high number of spots. So you got complete flexibility with the machine. So you're able to choose 600 different combinations. I tend to use a few of the combinations and tend to repeat the same thing, and you'll see it later when I show you the photographs. But it gives me flexibility on the machine. The Resurfix, I showed you earlier, it's the center part of the machine. It's easy to upgrade your system. It's a versatile system. It's easy to learn. It's got great user presets for each condition, and it's got this proprietary scanning technology. The handpiece itself is easy to use. It's lightweight. The scanners are built into the back. The fiber comes up here. You got your trigger switch, and then you got choice of 2 tips. So this is the sapphire tip, and you can see you got a sapphire window at the end. So the scanning takes place within the window. The sapphire provides contact cooling for the patient, which helps with some of the patient pain. You get good visibility because it's got a window that you can look through, so you'll see it scanning back and forth. So it's ergonomic, lightweight, really comfortable, easy to use. Then you've also got this precision tip. Precision tip I tend to only use on a few locations, but where it's really useful is if you want to give someone an eyelid lift and you want to go close on top of the eyelids, and this is the best handpiece to use. It allows you to do precision work. But remember that when you use this handpiece, you have to turn the energy down slightly because you've no longer got the contact cooling. Or I got some little cool contact rollers I use to be able to cool the tissue beforehand. So this is the precision tip. The machine comes with both tips. Technical specification is a 1565 nanometer fiber laser. Each microbeam is 110 microns. You can adjust it from 10 to 70 millijoules. The density can go from 50 to 500 microbeams per centimeter squared. You've got a hexagon, donut, circle, square, rectangle, and line. And you can see the different sizes. A line will go from 5 to 18. A square will go from 5 to 12. And a hexagon will go from 5 to 18. The tips are reusable. You can easily clean them. They're easy to use. You've got contact cooling. It's integrated, 10 degrees. You can fire up to 2 seconds, and you have got a choice of a hand control or foot switch. I tend to use a hand switch. It's easier to use, but it does come with a foot switch. You can see treatment visibility. You get great treatment visibility. It comes with an aiming beam. You can adjust the intensity of the aiming beam. If I want to do an individual wrinkle, I don't want you to illuminate too great, so I can turn the intensity of the aiming beam down. So you can adjust that. And the aiming beam is an exact representation of the size of the scan. You can see afterwards, this is immediately after treatment, probably 10 minutes after treatment, you can see the area swells up. So you get this edema taking place, you get the swelling. It's actually, the patients quite like it, because when you use, I'm going to show you how I treat a wrinkle and how I just go into the line. If you just go into the lines, immediately it looks like the wrinkles have disappeared because you get this swelling in the wrinkle itself. and that's quite a really good thing. But remember, that's a temporary effect because it takes 3 months to stimulate collagen. Histologies I showed you earlier. If I want to go superficial, I can choose 20 millijoules. If I want to go deep, I choose 70 millijoules. Depth of penetration depends on the energy you're setting. So if you want to do a wrinkle or a scar, you have to go deep. So you have to do that at high energy. But remember, if you're going to use high energy, you've got to use a small density. If you were to use a high energy with a high density, that would create too much trauma in the tissue. You end up with a longer recovery period. With all Luminous systems, they come with great materials to be able to use. This is a facial mapping guideline. It's a great guideline to get you started. It gives you a little bit more flexibility than looking at just the machine itself, but you can look at all areas and look at the typical millijoules you're going to use. It'll tell you about coagulation depth and the coagulation width, and it's a great guideline. It gives you the energy flexibility that you can use on each area. These are all available on the Luminous Partner Zone. Once you have the machine, you get access to the Partner Zone. It's like an online learning university. It's got all the materials, videos, everything you're looking for to help you run a safe and successful practice, as well as all the marketing information. But for me, it's been a great clinical support. It was when I first looked at stretch marks, I downloaded this procedure. It's a great guideline to get you started. It tells you exactly, talking you through how to treat a stretch mark and how to get the best result. There are lots of these guidelines on the Luminous Partner Zone. If you look at some of the results, if you look at this result here, see a full face resurfacing by Matteo. You can see he did 2 passes, 200 microbeams with 43 millijoules, and then he carried out 300 microbeams with 50 millijoules on the small spot size on the large blemishes, and then 300 microbeams, 50 millijoules per centimeter squares for 2 lines parallel to the jaw. If you look at the next one here, this is stretch marks before and after 3 treatments. So he's used 300 microbeams with 40 millijoules at the base of the stretch marks, and 150 microbeams with 50 millijoules over the entire area. But all this information is available on the Luminous case study book. So if I'm not sure about a procedure, you can always look in the case study book, pick out a picture that's similar to what you're looking to treat, and it'll have great guidelines on it. It'll give you an idea of how to use it. I use it slightly differently now, and I'm going to talk about that technique at the end. Again, this is some off-face resurfacing. You can see the stretch mark on the breast area. Again, he's used 300 microbeams, 40 millijoules at the base of the stretch mark, and then 150 microbeams with 50 millijoules on the entire area. Again, another image. Again, another image. You can see on the left thigh, and you can see the 3D imaging as well, showing a great reduction. And this is a great system for stretch marks. It's the machine of choice. And when you come to scarring, again, you can see you treat the individual scar, then resurface over the area. So 300 microbeams, 40 millijoules in the base of the scar, 200 microbeams and 50 millijoules over the entire area. So you use the less number of microbeams to scan the area, but more microbeams in the area base is going to treat. I do it in reverse that, and I'll explain my logic behind it. And again, another one, you can see on the scar, you can see a scar here, so you can see the before and after 4 treatments, almost completely gone and invisible. A fantastic result. Scarring before and after 4 treatments. First 2 treatments, 100 microbeams, 60 millijoules on the thick scars, and then the last 2 treatments, 250 microbeams, 45 millijoules on the scar, and 150 microbeams, 50 millijoules over the entire area. Another one with Matteo, and you can see before and after 4 treatments, and a great desirable result. Here you can see a photograph from a doctor in the US. You can see the wrinkles before and after, and a great reduction. Probably on this patient, I would choose to use a photofractional treatment. I think you should use an IPL first of all to target the areas of pigmentation and redness, and then you should resurface over the top. You may recall from last week when we talked about doing a triple pass technique with the IPL. But we would first of all, in this type of patient, we'd use a 755 filter to stimulate collagen. Then we use 590 filter on the IPL to target the blood vessels, the redness, and then we'd use a 560 to target the pigmentation. In reality, I wouldn't use that technique, because what I would prefer to do is start with my IPL. Don't use the 755 because I don't need to use that. I would start off by using a 590 filter to do the vascular. Then I would use 560 for treating the pigmentation, and then I would switch to Resurfex. So remember, it's important, if you're going to mix Resurfex with IPL, it has to come after the IPL, not before. So what I would do, I would done my 2 passes IPL, then I would take my Resurfex and I would take a high energy with a low density, and I'd go into each line. And then I would resurface at a medium energy and medium number of spots over the complete area. That will enhance my results on the pigmentation, but will stimulate collagen at the same time. And I'm pretty sure that would give you a much more desirable endpoint and result. You can see the other side of the face here. These are good reduction in wrinkle depth. So the technique I would use, this is, we look at the patient here. If I'm looking to treat the wrinkles on the eye here, I would prefer to use a really high energy just in the wrinkle itself. So 150 microbeams, 50 millijoules first treatment. Second treatment, I'd probably go up to 60 millijoules. The idea behind that is that you can break up that wrinkle so that it'll have a better chance to stimulate collagen. So I would go into the trough of the wrinkle and use low number of microbeams and a high energy, and that'll immediately puff up. So now it's puffed up, you have a much better chance of stimulating collagen. Then the second pass, you stretch the area. So I stretch the area out, so stretching the wrinkles out. And then I would use, on the first treatment, I would use 300 microbeams, 30 millijoules. And on the second treatment, I'd consider going slightly higher, maybe 300 microbeams, 35 millijoules. And I would use a large hexagon then, because hexagons fit together really well. I put in the point of the hexagon right in close here, to try and get in as close as I can, and to rejuvenate this area. Remember, you're going to have to turn the energy and spots down for right into the eye if you want to go close to the eye, or you want to do an eyelid lift. So around this area. And the settings here I'm talking about are generally 1 to 3. Skin types 4, 5 and 6, you'd have to reduce the energy and passes, and there are great guidelines online, and certainly you'll get that in the Luminous training to be able to look at that as well. If I'm going to do these types of two, I probably would have done this slightly differently. I would rather go with the first pass, 150 microbeams and really high energy, and using maybe a rectangle here, circle on this one, circle on this one, circle here, and I'd fill all these in. So on this patient here, in any of these acne scars you can see here, I take a small circle possible and fill these in with 150 microbeams, 50 to 60 millijoules. I then, on both patients, would, on pass 2, do 300 microbeams, 30 millijoules over the entire area with a large hexagon. And again, you'd still be looking at 3 to 5 treatments to get the perfect and desirable result. How do you reduce pain? You can use topical anesthesia. I have no scientific evidence for this. It's only on what results I've experienced and people that I've been involved in training. Generally, I find that if I don't use topical anesthesia, I get a much better result. I'm looking at the science of that at the moment. Generally, if I don't use topical anesthesia, I get a much better result. So, if you're not going to use topical anesthesia, you still need to reduce the pain, because these can be uncomfortable treatments. So, I tend to use this. I can use the Zimmer cooler. The Zimmer cooler is great. Cold air blowers. If you've got a Zimmer cooler, it'll keep it down 4 or 5 degrees. Patient can control the pain themselves, and it's a great way to do it. You can use cold packs. But the biggest thing impact I've realized is the smaller scans. When you do a big scan, 18mm, it takes quite a while to finish. So if this is taking a couple of seconds to finish, the patient becomes really uncomfortable. Whereas if you do a smaller scan, it's over instantaneously. So I tend to mostly now, if I don't use topical anesthesia, I switch from an 18mm down to about a 12mm. Now, there's no difference in the end result. and the time takes the same because a smaller scan is over quicker. So I'm still able to have the same procedure time, but it gives the patient a little bit more comfort. So generally, most of my pain control is done with some sort of Zimmer cooler or equivalent machine, and then I tend to use the scan size depending on the patient comfort level. For me, it's an easier way to control the pain, but it gives me the better control and the better result. Especially if you're looking at doing a photofractional treatment with it, then to use topical anesthesia, you'd make the blood vessels disappear. So then your IPL has no impact. So for me, the better pain control is some sort of Zimmer cooler, but also smaller scan sizes. It's important to get your aftercare right. It's important that you cool the area down. The patient's going to feel really warm. It's going to be very uncomfortable. So what we have to do is maximize minimize the impact on tissue, and we can do that by cooling the area down. I take the time of using a 15-minute cold ice mask. You can buy them from various different suppliers. You can see the mask here. I generally put maybe some hyaluronic serum on the area. I then put the mask on top, and I leave that for 15 minutes. Now, some people also then use one of the LED devices because that also helps to reduce redness. I tend to just use the ice pack. I put it on for 15 minutes. I've got these nice little cold rollers that I use, and I get the patient to roll it. So these cold rollers come out of the fridge. They roll it over the mask, and it keeps the area really cool. You take the mask off after 15 minutes, it'll be really warm. But now the patient has already started to cool down. So then what you need to do is use the correct type of aftercare. So I finish off with, I prefer to use this phytocorrective gel. I get it from SkinCeuticals. I put the product on. It's got scientific evidence to reduce skin temperature. So generally when I use the phytocorrective mask, it reduces the temperature by 3 degrees and the discomfort goes away. I then give them a small little pot, to be able to take home, and I tell them, right, I want you to apply this now when you get home, and I want you to apply it before you go to bed tonight. And generally, when I wake up the next day, there are no issues. The redness is gone. I also sell them a hydrating product. So again, I use the SkinCeuticals products, like a vitamin C based product. But you need something that you can give the product to hydrate the tissue. People who you don't hydrate the tissue, you can end up with dry skin. And that can last a few days, whereas really what you want to be able to do is hydrate the tissue. So there's 2 things you need to do is giving them a hydrating product and tell them to put that on frequently throughout the day and for the next 5 days. But also they've got to drink water. It's really important after any of these procedures that you drink 2 litres of water a day. So by getting this aftercare right, I can minimize the side effects. Generally, most patients I treat, but the next day there's no issue. Luminous have great training and practice enhancement tools. All these are available. I told you on the partner zone system. They've got in-service presentations, facial mapping systems, physicians' presentations, lots of white papers, an amazing before and after casebook. And anybody using M22 is, if you want to maximize your publicity, send Luminous photographs because they're used on the Luminous website and on the casebook. It enhances your practice as well. Patient materials and website information, lots of patient videos, product videos. There's a whole university on the partner zone, the whole educational system that you're able to tap into. For example, the white papers, Facebook. Really one of the exciting things is when you look at treating someone, you need to do a complete treatment. So I'm a real fan of photofractional treatment. So photofractional is when we combine the IPL with Resurfax. I told you about earlier, I said how I would prefer to use the IPL first to do 2 passes to address the pigmentation and veins, and then I would use the Resurfax. Some people go even further. If someone comes in to me, they've got maybe some facial redness with some pigmentation, they've got some veins around the nose, they've got open pores on the nose, and they've got general lines and wrinkles, I look at maybe a 4-stage approach. So I would start off by treating the veins on the nose with the IPL with a vascular filter, so I can take the veins out in one treatment. I would then do the cheeks, where I would use a 590 filter first, then I would use a 560 filter. I then take my Resurfx, and in any scarring or any lines, I would go in with a line or a small circle, and I told you where I would use 150 microbeams at about 50 to 60 millijoules. I fill in each one. I then would take maybe 300 spots or 250, because I'm combining it, and about 30 millijoules, and do an overall treatment of the whole area. Now I've avoided the nose, because generally what I find then with the nose is the final treatment on me, I prefer to use a carbon peel. I put slight carbon paste on, let that sink in, and I finish the nose off then by doing a carbon peel with a Q-switch laser, which helps with the open pores, and we're going to discuss that next week. So combination treatments are absolutely the way forward, and it gives you the best desirable result. Here's some photographs from the Five Clinic, from Jude at the Five Clinic. Five Clinic is a prestigious clinic based in Harley Street. And you can see here Jude has used a first pass with an IPL at 560 filter, second pass with a 515 filter, and then she's finished it off with 250 microbeams, 30 millijoules over the entire area. And you can see a great desirable result. And again, another photograph, and you can see here the difference. Look at the before and after photograph, you can see a reduction in pigmentation, a reduction in redness, and a reduction in wrinkle depth. And that's the beauty about combining the technology. I think hands are understated. Hands are a problem for people. It's a really dead giveaway of age. It's often neglected. By doing a combination photofractional, you can produce an amazing result. If you look at the hands before and after, you can see they look many years younger. The first pass on this particular one, I did during a demonstration for Luminous for one of the clients who's now an M22 user, and we used a 515 filter first of all, 4 millisecond pulse duration, 14 joules per centimeter squared, and then immediately carried out a Resurfx procedure on top. Now you can see the end result is a desirable result, but you have to warn the client it's a significant recovery time. It's really going to hurt. It's going to hurt for the next day. It's going to get dark. It's going to get much worse before it gets better. It'll draw all the pigmentation out, and it'll look pretty awful for 2 weeks. But after 2 weeks, then the recovery starts. And after 1 month, you have the most amazing results. But you've got to be prepared to counsel the client and let them know about the side effects of doing the hands. But the result is worth it. If I was going to, and nowadays when I do hands, I generally do one hand first, and then on another appointment do the other hand, just to allow them to, because the recovery time. The M22, you can treat over 30 different skin conditions. I told you about the IPL already. It's the most amazing IPL technology. Because of the vascular filter and the technology behind the IPL, I don't need any need to use my pulse dye laser anymore. I get better results with the pulse dye laser. It's great for pigmentation. It's also a pretty good hair removal system. Those who saw the talk last week, I showed you my own personal experience, my own before and after photographs. It's an amazing hair removal system as well. Not as fast as, let's say, a Light Shear or the Splendor X or some of the other hair removal technologies, but it's a good one, and it's still a machine of choice I would use if I wanted to treat fine hair. Then you have the Resurfx model we talked about today, an amazing for wrinkle reduction, for scarring, for stretch marks. And next week we're going to look at the third element, where we look at the Q-switch system and the multi-spot ND YAG. It talks predominantly on the Q-switch, but we're going to cover some of the technologies in the multi-spot ND YAG as well. The great thing about the M22 is easy to use. Now, people who have met me know that I tend to only use the advanced settings. I know how to manipulate the machine. I know how to get the best results. But the machine, when you first use it, it's got all the presets built in. They're safe, but more importantly, they can give good results. There are no disposable costs. You pay for the machine and there are no running costs. Part 3, we're going to look at the Q-switched system for tattoo removal and carbon peels, and that's taking place on the 5th of December. Here's a little flavour of what it's going to do. So you can see open pores being treated. I tend to use this mostly for the nose now because I tend to, on the cheeks, I still would do Surfax first. But you can see carbon peel is really popular. Clients love it. It's a more sought after treatment. And I'll show you how to talk about this next week. Thank you very much for listening. Hope you're all okay and got sufficient information. Are there any questions? Well, the great thing about, because it's Resurfax is absorbed in water and it's non-ablative, you can treat any skin type. You do adjust the parameters accordingly, but there's no issue treating skin type up to skin type 6. So you can treat all skin types. Typical recovery time depends on how aggressive you are and how you treat the patient afterwards. My recovery time tends to be within the next day because I spend a lot of time on the post-treatment care. But depends on the individual. Some people have a treatment and within 4 hours, everything's fine. But I've seen extreme cases where some people, 5 days later, there's still some redness there. But they tend to be the ones that have had really high energy, big scans in one area. If you limit it and use the technique I talked about, then you generally within 2 days everything's fine. But most of my clients, next day when they wake up, there's no issue. I guess that's a question more for Luminous. You should contact Luminous and arrange a demonstration. What I would do is, if I was you, if you're booking a demonstration, make sure you can treat some clients. I looked at lots of machines, but what I'm impressed with is the ability to treat veins. So I would urge you, if you're going to book a demonstration, make sure you book a client in where you can do some facial veins. Nasal veins are particularly difficult, so they're quite good to be able to see in a demonstration how to treat them, get used to using the advanced technique, because there are lots of IPLs, but the beauty about the M22 is the fact you've got these advanced settings where you can alter the energy in each pulse, and it's good to be able to see that and appreciate it during a demonstration. So I'd certainly look at booking a patient. I would look at booking a patient for wrinkle reduction. Remember in mind when you do a demonstration, if you are going to select a client for Resurfax and it's skin type 1 to 3, there's no issue treating. But if it's skin type 4 or over, it's recommended that you use some sort of skin serum like hydroquinone beforehand to reduce the amount of melanocytes 4 weeks before. So I would look at booking in a resurface treatment. The other thing is really good to see is an up and coming treatment. I would certainly look at doing a carbon peel with a Q switched because that's quite a good treatment as well.